it's me, Marika. I'm gonna redo video number 2 for you guys because the volume is very low and I don't like that. I hope you could hear me on this video, so bear with me. But just to repeat what I was saying is that this morning I did an HBT. I am 13 days past ovulation and it is negative. So yes, I feel a bit depressed, I feel a bit down because of that. And I was actually feeling pretty awful this morning, a bit stuffy nose, everything you could call it, cramping, feel like AF is on me, but I don't have a menstrual cycle right now, but it just feels like I'm cramping every minute, and so it feels like I'm wet, but I'm not really wet. Anyhow, so I have a beta to do tomorrow, which I'm not going to do tomorrow. I'm actually gonna wait one day and go on Thursday. I don't really feel like going tomorrow, honestly and truly. I could just walk into my clinic. My fertility clinic is very flexible. How they do it is they have you come in anytime, Monday to Friday, from 6:30 in the morning till 9:30. So you drop in, and it takes me roughly 15 minutes to get my blood done, get an ultrasound done, and see a doctor. The most I've stayed in there was probably 45 minutes because it was really busy, normally at a holiday time. But besides all of that, I keep you guys updated. I want to do a live pregnancy test with you guys, so don't worry. We'll see, maybe my BFP would come. Just doing it with you guys. But I wanted to touch on a topic that I know some ladies have a bit of concerns about. I was speaking to one of the ladies in my group that I have, and she said to me that how it just came out of the blue that she feels bad that she feels this way, or she thinks this way, but she feels that I should not be worried or frustrated with trying to conceive because I have been pregnant before and she has never been pregnant. Now, I know everybody's entitled to their opinion. But there's just some things you just don't say, especially when you're not in a situation. Because for starters, I would never want a BFP and have it taken away from me. Rather not get it. What's the point of just seeing 2 lines? I can see 2 lines and take a trigger shot. But the fact of the matter is that it still hurts any way you slice it. And that is not, and it is something you should feel bad about, because if you have that type of mentality, you probably think that your story is the saddest. Everybody have a story. Everybody have a story. It may not be the saddest story. Your story may not be as bad as another person, but to that person, it still hurts. It hurts big time. And for her to say that, at first I just brush it off like what I normally do. I just like to brush off stuff. But then when I asked her and I kind of clarify what she's trying to tell me, I said, wait, this lady's really trying to tell me I shouldn't feel frustrated. But of course I'm going to feel frustrated. Who wouldn't feel frustrated? 6 years you're trying to conceive a child. You're doing everything you have to do, going to fertility clinic, taking this drug, taking this injection, and nothing happening. You must be mad. Sorry, when I get angry, Trinidad just come out all the way. But besides that, people just watch what you say. Just because you're not in a situation doesn't mean you could be ignorant to the fact. Alright, I'm not going to call any names. I still care about the lady. It's just a little disagreement, but it's not the first time I've heard something like this. But it has never been said to me. But as it's said to me, I'm going to say something about it, because everybody deserves some sort of support. And especially if you are trying to conceive in any situation you are in, it is frustrating when it doesn't happen. And you have to realize is that everybody could take on so much. So who are you to think that your troubles is worse than mine? You don't know my mentality and I don't know your mentality. Yes, I could get pregnant, but the bottom line is I can't carry the child. And that is what we are trying to happen. And that is hurtful any way you take it. It's hurtful. Getting a BFP and getting it taken away from you, it's hurtful. Alright? So watch what you say. Goes for anybody else. Watch what you say. I'm not a very picky person. I'm not very malicious or kind of hold grudges or anything. If you say something out of timing, and out of timing means you shouldn't have said it, I'm going to say something. And that's how I roll. But you can't please everybody. That's the whole thing. I know you can't please everybody. Somebody's always going to be upset with something you say and stuff like that. But you have to pick what you say. At least try to pick what you say and try to curve what you say. Because saying something like that, I don't think it's something you should actually say to anybody. But that's all. It's just a little rant. I know, sorry. But I just had to get it off my chest. This is what I had to get off my chest in video 2. So since I'm redoing it, I'm going to state my point once again. Stay tuned. Live pregnancy tests and some more stories. I'll tell you the story about the doctor I went to when I was 24, who said I was 300 pounds. Mind you. Anyhow, I was 300 pounds, yeah. But here comes the little kiddos. Gotta go. Hi, Ayla. You want to say hello to the camera? Hi, this is my goddaughter. Say hi. Bye, everyone.
I will hear the face.
Okay, bye.